interesting topic, that is GVHD. Okay, I will make it very simple that for sure shot by the end of this session you will remember and you will sure shot can answer this question. See, graft versus host disease. Okay, now let me explain two terms. Okay, I will explain this very clearly, but see, I will explain two terms now. What is donor and what is recipient? Okay, what is donor and what is recipient? Donor, who is giving, recipient, who is taking. Okay, now I think you have clarity about what is donor and what is recipient. Okay, see, this is our body and our body has cells. Okay, there are T cells in our body. Okay, daily this T cell will come and check whether the cells are self or non-self. So how this T cell can detect this? There is an ID card, an ID card near every cell. Okay, on the membrane there is an ID card for every cell in the body. Every cell in the body, that is called HLA. Almost every cell have this HLA identity card, which they will show while the patrolling T cell come to check whether it is self or non-self. So if it is detected as self, the T cell will not kill them. So they are showing the identity card. What is the identity card name? The identity card name is HLA. What is the full form? Full form is human leukocytic antigen. Okay, they are showing this identity card to T cell. Okay, fine. Now see, this is the recipient and this is the donor. This is the recipient and this is the donor. The recipient had his kidneys failed, so what he thought to take kidney from the donor. What he had done, he had taken the kidney. Okay, it is fine, but inside the recipient, okay, it is now inside the recipient, right? So now think, see, now this is the kidney of the donor, this donor inside the recipient. Now our T cell is coming for patrolling. Okay, our body has our HLA molecule and this HLA molecule is specific for every person. Okay, so now what happened? Now the T cell came to patrolling. After the T cell came to patrolling, this kidney which is taken from the donor should show the identity card, right? So it is showing the identity card, but as every person have different HLA, it is very specific for a person. So this HLA is detected by our T cell which is patrolling as non-self. See, it is thought as self because HLA is ours, and okay, our normal tissue is not damaged, but this kidney is from outside and this HLA molecules are from outside. So our T cell had checked its identity card and told, you are not my property, you are non-self, so I will destroy you. So it destroyed it. So whole this process, this rejection of an organ which is taken, which is transplanted, it is called graft rejection. Okay, it is called graft rejection. It is T cell mediated, it is fine, but our point of concern is not graft rejection. Our point of concern is GVHD, graft versus host disease. Graft rejection is different, graft versus host disease is different. Okay, now I will tell about graft versus host disease. See, we understood graft rejection. What? The T cells in our body are destroying the foreign kidney. But what if we are taking something from donor and we are adding in recipient? What if this something kill this? Means it is killing the donor tissue. Okay, very easy. Here we took the example of kidney. Now we'll take another example like allogenic hematopoietic stem cell. Allogenic hematopoietic stem cell transplant. Okay, that is nothing but bone marrow transplant. Okay, I think if I explain here, you will think it's very tough. See, okay, here daily a policeman is coming, right? Policeman is coming to check. What if, see, here in the graft rejection, the persons, the ID cards are changed. That means the HLA molecules are different. But what if I change the policeman? I take the T cell from outside. Okay, I am taking from the donor the T cells. Okay, if I take from the, if I take from what? If I take T cells from the donor, what happens? This T cells. See, now these are foreign T cells. These are foreign T cells. This foreign T cells will detect these ID cards, but will they detect correctly? Why? Because those T cells in the donor, they are habituated to their body HLA molecule. But here the HLA molecule is different. Why? Because the T cell from the donor now is in recipient. So this T cell which is taken from outside will think this as non-self and will create and will, okay, this T cell will proliferate and produce tumor necrosis factor, interferon gamma, interleukins 2 and chemokines. Okay, they are producing this and further tissue damage. But here whose tissue is damaging? Here our recipient tissue is damaging. Why? Because we had took foreign T cells. Okay, why will take foreign T cells? See, in case of any leukemia, see, if this recipient is recipient, if the person who need to take the bone marrow, one who is he is having leukemia, so he need a bone marrow transplantation, so he had taken bone marrow. So this bone marrow contains these T cells. Along with the bone marrow, the T cells also will come. The T cells will destroy our human tissues. Okay, this is called GVHD, graft versus host disease. Okay, I will make some more clarity. I think you had got clarity almost, but I will make it some more simple. If I make a differentiating table, you will understand. Graft rejection, graft rejection, and GVHD, graft versus host disease. See, this is the human tissue, and this is our T cell. Policeman, he is checking our HLA molecules daily. Human leukocytic antigen daily he is checking, and he is reporting as self. So no killing of our tissue. But now we are taking transplant, right? We are taking a foreign kidney. This is foreign kidney transplant, for example. Say we can also take example like liver also, you can take, but I am taking kidney. this kidney should show its HLA molecules. But are these HLA molecules of our body? No, they are not our body. So our T cell will detect these HLA molecules as non-self and they will destroy. So now you might think, I had told here foreign T cells will come in bone marrow transplant. Now you may ask, why if in kidney transplant won't they come? No, they don't come. See, I will tell those doubt also. I will clear you. Okay, now just know about graft rejection. Foreign kidney we had took HLA molecules are different, so our body rejected and destroyed the kidney only the kidney, the foreign kidney. Now see, now we are taking bone marrow from the patient, not kidney or not liver. Okay, this bone marrow has foreign T cells we are having. Okay, now the bone marrow is safe, his bone marrow is safe, but see, this is our normal tissue. This T cells along with that bone marrow had come, so this T cells will come to patrolling. This foreign T cells will come to patrolling and see our HLA. This is our HLA, this is our human leukocytic antigen, but this T cell is took from another person. This is thought like non-self. That means this foreign T cell will think this HLA is not his. It is obviously not his because this is donor's T cell. So it can only tag as self if it is in his own body, but now it is in our body, right? So it detects it as non-self and destroys this tissue. Okay, this is GVHD and this is graft rejection. So now you may have a doubt, in what conditions this GVHD might happen. I will make you, okay, I will not rub this, I will rub this. I will make much more clarity for you. See, there are 3 criteria. Immunocompetent T cells. See, we are taking something we need from the donor, like liver, kidney, bone marrow. Okay, if the particles, if the organs, if the substance we are taking from the donor have mature, which are potent T cells, that means immunocompetent, they are competent to carry out T cell mediated reactions, then this GVHD will occur. Only if the substance which we are taking, if it have T cells of the donor, we will have this GVHD. This is the first condition. Second condition, see, now this is my body and this is a foreign body, foreign donor what, donor transplant. Now in my body there is T cell army. Okay, sorry, I will write here, you might not. Okay, this is the donor transplant and this is my body. Okay, this is my body. Okay, now here I have army of immunity like T cells. Okay, T cells and B cells also, but here in mostly in graft rejection GVHD only T cell mediated. Okay, I have army of T cells. Here if I have normal T cells, my immunity will destroy it even though it has T cells. See, that graft is anyway compared to our body, it is very small, right? So if my immunity is not suppressed due to some reasons, due to any diseased condition or due to taking immunosuppressives, if my immunity is not suppressed, I will only kill that. I will only kill that. What? I will only kill that transplant which I took. But if I am immunocompromised, I don't have some enough immunity to deal with this. So it might kill this, not surely kill. It might kill this. Okay. So the second condition in which GVHT, see, if this content, first thing is it contain T cells and it is killing our body. So the immune suppression is, we can take a second point. Okay. Third point. Third point is, first one we had speaking about immunocompetent T cells if they are present. Second one, immunosuppression. And one more, if, see, this is the donor and this is the recipient. See, I have different antigens, you have different antigens, and every person have different antigens. So if the antigens which are present in the donor are not present in the recipient, if they are not present in the recipient, this might happen. What are those antigens? Those are nothing but HLA. HLA in me is different, HLA in you different, HLA in every person is different. So third point is, you right, I will detect if the antigens which are present in the donor are not present in our recipient, this GVHD might occur. Okay, I made it very clear. I think so. But see, I will explain. Some more topic is there. I had told the conditions wherein all GVHD can occur. First thing, tell me if the transplant contain immunocompetent T cells, and the second point, if the person is if the recipient is immunocompromised. Okay, and the third point is, if the antigens like HLA which are present in the donor are not present in our human body, in the recipient body. So what we advise in graft transplantation, we advise to take it from twins, identical twins or closely related individuals. Why? Because this will be matching and there will be no GVHD. Okay, that is the point why we will tell we should take uh, we should take the graft from the closely related individuals. This is the reason why we tell it. Okay, now I discussed. Okay, I forgot to tell, and these three are there, right? These three what conditions, that is immunocompetent T cells, immunosuppression in the recipient, and what antigen present in the donor and not present in the recipient. These all are called Billingham's criteria. This is called Billingham's criteria. There are three criteria in the Billingham's criteria in which GVHD might occur. Okay, I'm from the starting. I'm telling, in the GVHD the T cells of the donor will kill the recipient. What tissues it will kill and why it will kill. Okay, this is very interesting. See, this is a foreign T cell. It came inside the body and it started killing. So see, most of the T cell mediated killing will be on rapidly dividing tissue. Rapidly dividing tissue will be more susceptible to be killed by the T cell mediated activity. Okay, what are the rapidly proliferating cells? Skin we can take, mucosa. Okay, we can take, tell me two examples of mucosa. Intestinal mucosa we can take, and we can take bile duct. See, why I am only telling this bile duct, this intestinal mucosa, the skin, won't it happen in other organs? See, it will happen in every organ, but it will mostly go near where there is rapid cell proliferation. As these places have rapid cell proliferation, see, skin will be shedding off, right? So it will have rapid proliferation of cells. So that's why, that is the reason. Intestinal mucosa also same, bile duct also same. Okay, this skin will this T cell from foreign donor or transplant will come and destroy this skin. Desquamation, our skin layers will be damaged. This is desquamation. And in the mucosa, intestinal mucosa is damaged. Due to intestinal mucosa damage, we will have gastrointestinal pain, sorry, abdominal pain, we can say abdominal pain, and we can have malabsorption, and what all we can have? Malabsorption, we can have abdominal pain, we can have, and diarrhea we can have. Okay, these all we can have. Okay, in the bile duct, see, this bile duct is opening into intestine, right? This bile duct will carry what? Bile juice. Bile contain what is the constituents of bile? That is bilirubin and bile salts, right? So this bilirubin will accumulate. See, why this bile duct is obstructed? Why? This T cell is damaging this, so the cells, what, the duct will get inflamed and there will be obstruction. This obstruction will lead to bilirubin accumulation. This will lead to jaundice. Okay, this is due to bile obstruction. And skin, I told, intestinal, abdominal pain, malabsorption, and diarrhea I had told. And these all conditions we are seeing, right? This is the first stage, that is the acute stage of GVHD, gastro sorry, graft versus host disease. Okay, this is the acute stage. That means it will occur within 100 days. Is 100 days seeming very large? And it is still called acute phase. See, this T cell mediated things will take time. Okay, and in that also it is foreign, right? Not ourself, right? So it will take time. And if there is an acute phase, there will be also chronic phase. In the chronic phase of GVHD, the GVHD resemble autoimmune disease. See, if there is a long standing inflammatory reaction, this chronic stage will happen more than 100 days, after more than 100 days, if not treated. So this chronic stage, what will resemble autoimmune disease. How? See, in the chronic long standing disease, there will be prolonged inflammation, and this prolonged inflammation will lead to prolonged damage of the tissues. And due to prolonged inflammation, prolonged damage, the healing will take by fibrosis. The healing is taken up by fibrosis. So it might also damage our major organs like pancreas. So some of the autoimmune disease it might represent. Okay, this is the chronic stage. It might resemble autoimmune diseases. Okay, now what is the treatment? See, and I had told in the Billingham's criteria, if only immunocompetent T cells are, means the active T cells are there in the donor tissue. So in the transplant, the active T cells must be there. Okay, what all contain active T cells. Bone marrow can contain active T cells, and umbilical cord blood can contain. Okay, so this must be taken care. How it can be taken care? Okay, I will tell about treatment. I will tell about treatment. See, this is the recipient. This is the donor. If I suppress his immunity before giving the graft, what happen? GVHD might occur. If I suppress the recipient immunity, this if okay, not every time. If it contain active T cells, immunocompetent T cells, it might kill the recipient himself. Okay, but okay, if I decrease immunity here, it is killing my body, so I won't decrease. After taking the graft, I decrease. Okay, what if after taking the graft, if we decrease the immunity, this what if the graft, if the transplant which we are taking has this T cells also, the immunity will be suppressed in both of them. And it will be good. But as see, I already told, if this is my human body and this is the donor and it contain T cells, my body will contain relatively more antibodies, right? So it will kill this. See, even though I take immune suppressors after taking the graft, my body still contain more number of T cells to kill this graft. So what I have to do? I have to take immune suppressors before graft plus after graft. Why I am taking before graft? Before graft because if my immunity might kill this graft. Why I am taking after also? Because if the what if the graft contain T cells, it might kill my tissues. So I am taking after also immune suppressors, before also I am taking immune suppressors. I hope that you had got a very good clarity about what is GVHT. Thank you for watching, and if anything you did not understand or any queries are there, you can pin it in the comment section. Thank you.